This is the Coronavirus Morning Report for Tuesday, May 5th, 2020. I'm Jackson Bird. A new mystery illness affecting children may or may not be COVID-19 related. What is life going to look like until there is a vaccine? How long do coronavirus symptoms actually last? Will schools be reopening in September? And why the lockdown has created a field day for speeders. New York doctors are warning about a mysterious illness affecting children that may be tied to COVID-19. Quoting the New York Times, 15 children, many of whom had the coronavirus, have recently been hospitalized in New York City with a mysterious syndrome that doctors do not yet fully understand, but that has also been reported in several European countries, health officials announced Monday night. Many of the children ages 2 to 15 have shown symptoms associated with toxic shock or Kawasaki disease, a rare illness in children that involves inflammation of the blood vessels, including coronary arteries, the city's health department said. None of the New York City patients with the syndrome have died, according to a bulletin from the health department, which described the illness as a multi-system inflammatory syndrome potentially associated with COVID-19, the disease caused by the virus. Reached late Monday night, the state health commissioner, Dr. Howard A. Zucker, said state officials were also investigating the unexplained malady. The syndrome has received growing attention in recent weeks as cases have begun appearing in European countries hit hard by the coronavirus, end quote. An antibody test made by the pharmaceutical company Euroimmune US became the first antibody test to receive government authorization by the Food and Drug Administration here in the US. The test only requires a finger prick of blood to collect the materials needed for analysis. No word on how soon the test might be able to be distributed. Following up on the reopening stories, Italy had its first official day of eased restrictions. This is quoting the Washington Post. Across Rome on Monday, cars wriggled free from spaces they hadn't left in 8 weeks. Runners laced up their shoes and headed outdoors. The shutters lifted on restaurants and bakeries, even though it was just for takeout service. And Marco Secchi, a 52-year-old shoemaker, seeing it all, yelled with joy while walking down the street. "Bella Roma!" he cried out, his voice echoing off apartment buildings. "It's a feeling of liberation," said Secchi, who returned to work for the first time in nearly 60 days, end quote. Germany is looking to restart internal tourists to resume circulating by May 25th. In Hong Kong, bars, fitness centers, and other places are reopening this week after more than 2 weeks of no new local cases. Spain also eased its lockdown for the first time yesterday, but there were plenty of rules. People were only allowed outside to exercise, not to just hang out, and you could only go out at specific times set aside by age group. Another new mysterious early case has popped up, this time in France, and this time earlier than almost anywhere other than China, quoting the Washington Post. A patient admitted to a hospital near Paris in December was infected with the novel coronavirus, a team of French doctors said, signaling that the virus may have reached Europe far earlier than previously thought. In a study published Sunday in the International Journal of Antimicrobial Agents, the doctors said that frozen samples taken from patients admitted between December 2nd and January 16th had tested positive for the virus. The patients were experiencing flu-like symptoms, but were not ultimately diagnosed with influenza. Quote, "COVID-19 was already spreading in France in late December 2019, a month before the official first cases in the country," wrote the doctors at Groupe Hospitalier Parisien in Saint-Denis, a northern suburb of Paris, end quote. The first 2 cases of COVID-19 were not confirmed in Europe until January 24th, and those were both patients who had traveled to Wuhan, China. World leaders met yesterday in a virtual online summit to pledge more than $8.2 billion to develop and mass-produce drugs and vaccines to fight the coronavirus. Among the leaders who took part in the video conference were Germany's Angela Merkel, France's Emmanuel Macron, Britain's Boris Johnson, Japan's Shinzo Abe, Israel's Benjamin Netanyahu, and Turkey's Recep Tayyip Erdogan. The U.S. did not participate. And finally, a draft government report circulated yesterday that predicted the daily death toll from COVID-19 could rise to an average of 3,000 per day by June 1st, more than double the current rate. The White House and the Centers for Disease Control and Prevention both disavowed the report, although the slides carry the CDC's logo. The report has been controversial because no one is quite sure of the provenance of the data, and also because the report estimates that new cases would also rise to 200,000 a day, which is close to 10 times the current rate of new infections. It's unclear how infections could rise by an order of magnitude without deaths doing something commensurate. However, the report also provided new data relating to existing death rates, which is among the many data points we still, again, at this late date, are waiting on. The report said that around 16% of those hospitalized during a period beginning on March 1st died of COVID-19 per available discharge data. So this does nothing to tell us the overall mortality rate of catching the disease, but it does suggest that if you get a case of COVID-19 severe enough for you to require hospitalization, you have around a 1 in 6 chance of dying. So take that for what it's worth. We are now several weeks into stay-at-home orders. Unemployment is skyrocketing, and one of the fundamental questions in front of us as a society is, how do we reopen safely? What does life look like, at least until there's a vaccine? We've said many times on this podcast that the key mantra is testing, 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 and indeed, that is what many experts, economists, and epidemiologists are calling for. A dramatic ramp-up of testing so general stay-at-home orders can be progressively relaxed and people gradually feel safer going about their business. But as we know, that's not happening. Yet. In an interview with The New Yorker, Paul Romer, a Nobel Prize-winning economist who has served as the chief economist at the World Bank, explains why it's so important to have robust, regular testing if we're to have any hope of avoiding a major depression. Quoting from the piece, "The key to solving the economic crisis is to reduce the fear that someone will get sick if they go to work or go shop. So it's really about building confidence. The thing about testing is that it's easy to explain, and it doesn't frighten people the way digital contact tracing does. It's not subject to technological and social political uncertainty the way digital contact tracing is. It doesn't require the organizational capacity that doing human contact tracing does. It's really just a very simple, easy-to-explain idea that to control the pandemic, we need to get a reasonable majority of the people who are infectious into a quarantine, and then we're good. So that's really all it's about. So I want to try and articulate a very simple approach for managing this crisis because I think that's central to restoring confidence. For example, think about me going back to the dentist. Doesn't really matter what the law says or the governor says I can do. I don't want to go back to the dentist's office in New York City until I know that he can show me a recent negative test. And he doesn't want me to come into his office until I can show him that I've got a recent negative test. So I think it's easy to explain this idea to people, and I think it's also easy to convince people that this is something we could do for as long as it takes to manage this pandemic. Suppose it takes more than 24 months to get a vaccine. If it takes more than 24 months, I could see going and getting tested before I go to the dentist, and the dentist could get tested. Neither of us has a problem with that. I really think that confidence is so central to investment decisions, to planning, to anticipating the future, that we need something so simple that nobody worries if it's going to work. Nobody worries if we're going to abandon it because it's too painful. Everybody just says, okay, yep, that's the plan, and we're gonna stick to it. And then we go. End quote. Romer points out that the curtailment of economic activity is costing the U.S. about $500 billion a month, and that therefore, however expensive a testing regimen for the entire population may be, we'll be making a return on that investment. He also points out that there really aren't any alternatives. Quoting again from Romer's interview, "It's expensive to do what I'm proposing, but now we should look at the feasible alternatives, one of which is that we let this virus just spread through the entire population. That's going to kill at least 1 million people. And what people haven't grappled with yet is that the process of it spreading through the population is itself going to take a year. So this is not a quick path to reopening the economy, even if you're willing to sacrifice that many people. On the other hand, if what we're doing is using social distancing and staying away from each other, whether it's compelled officially or just automatic because we're afraid, if that's the way we're keeping the replication number of this virus below 1, we could be in this depressed state for 18 months, 24 months, a long time. And I think it's going to become politically unsustainable. So then, if you revisit 1 million people dead or depression for 18 to 24 months, 100 billion odd tests seems to me like a walk in the park. End quote. So here we are again, testing, probably backed up by a human contact tracing force of some kind, so that we can go to each other and say, I'm negative, you're negative, we're able to conduct business face to face. Until there's a vaccine, that's what Romer thinks life will be like, and he's probably not too far off the mark. So to that point, where are we with a vaccine? Well, there are more than 100 efforts underway. The White House has announced Operation Warp Speed, an attempt to get mass vaccinations started by January 2021. Quoting from the Washington Post, scientists at Oxford University have announced the most aggressive timeline with plans to make their vaccine, which depends on a weakened cold virus that typically infects chimpanzees, available in the fall. Moderna and Inovio are developing vaccines that ferry two types of genetic material into cells to train the immune system to recognize the distinctive spike protein on the surface of the coronavirus. A Beijing company is trying an inactivated virus. Giant pharmaceutical companies, flush with government funding, are turning their vaccine platforms toward the coronavirus. Researchers at Texas A&M University are repurposing an existing tuberculosis vaccine to see whether it can prevent deaths or severe illness. End quote. This sort of development timeline compresses what usually takes many years into, as Dr. Anthony Fauci of the National Institute of Allergy and Infectious Diseases has often put it, 12 to 18 months. How is that possible? The Post explains, quote, typically, human clinical trials occur after extensive animal testing. Then, a small number of human subjects receive the vaccine in a phase 1 trial intended to determine the safety and the right dosage. People are monitored for any side effects as well as early hints that the vaccine works. After carefully analyzing that data, companies decide to proceed to a larger phase 2 trial in several hundred patients, which looks for signs the vaccine is working. Then, they could proceed to a large Phase 3 trial in which people are randomly assigned to receive either the vaccine or a dummy shot, a definitive test of safety and effectiveness, which often takes thousands of patients and several years. End quote. That isn't happening for the coronavirus vaccine efforts. Instead, teams are running the phases in parallel, effectively trying to prove safety and efficacy at the same time. But vaccine experts expect that regulators, including the FDA here in the U.S., will hold firm against pressure, political or otherwise, to get vaccines out to market before they're proven safe and effective. As Peter J. Hotez, the dean of the National School of Tropical Medicine at Baylor College of Medicine, told the Post, they're good at holding the line and aren't going to do anything that's reckless, because if they did it, it could jeopardize the whole U.S. vaccine effort, especially with the anti-vaccine lobby. One of the many as-yet unsolved mysteries of COVID-19, the disease caused by the novel coronavirus, is that not only does its severity vary hugely among the population, its longevity, i.e. how long people have to live with its symptoms, varies a lot too. There are increasing reports of people suffering with COVID-19 symptoms for well over the expected 10 to 14-day period for so-called mild cases. Doctors don't know yet if that's because of the virus itself or some sort of post-coronavirus syndrome that kicks in even after the body has successfully rid itself of the virus. Dr. Eric Strong, a clinical associate professor at Stanford University's School of Medicine, told CNBC that he has had at least one patient who continued receiving positive test results from nasal swabs for more than a month. He noted that South Korean researchers have found this can happen because the test picks up inactive remnants of the virus, so the patient may no longer be contagious. He explained to CNBC, quote, it doesn't mean that patients can't remain symptomatic for prolonged periods of time as a consequence of their SARS-CoV-2 infection, but it would suggest that some are not still infected, which would be akin to post-Lyme disease syndrome. We're still figuring this disease out, and it may be a long time before we definitively know the answers to some of these questions, end quote. Dr. Esther Chu, a public health expert, encouraged patients who still feel sick after a few weeks to see a doctor in case a bacterial infection has taken advantage of a coronavirus-weakened immune system and moved in. But she pointed out that we just don't know enough about COVID-19 to be sure about what is going on. Quote, when you have a baby disease, which is 4 months old, what you see first is the most common experience. The experiences at the outer bands, the outliers, it takes a while for us to understand those.
Use the internet with confidence from your computer, tablet, or smartphone with ExpressVPN. ExpressVPN has you covered on every device. Simply tap one button and you're protected. ExpressVPN encrypts 100% of your data with best-in-class encryption, so your information is always protected. Each ExpressVPN server has an IP address that's shared among thousands of users. That means everything you do is anonymized and can't be traced back to you. Even in incognito mode, your online activity can still be traced. Even if you clear your browsing history, your internet service provider can still see every single website you've ever visited. That's why even when I'm at home, I never go online without using ExpressVPN. ExpressVPN makes sure your internet service provider can't see what sites you visit. Being stuck at home these days probably means you haven't been thinking that much about internet privacy on your own home network, but actually this is the perfect time to sign up for that virtual private network you know you've needed to set up to protect yourself. There's never been a better time to protect your online activity today with the VPN that I trust to secure my privacy. Visit my special link at expressvpn.com/report. And you can get an extra 3 months free with a 1-year package. That's expressvpn.com/report. expressvpn.com/report to learn more.
We've talked a lot recently about businesses and workplaces reopening, but what about schools? Many states have closed schools through the end of the academic year, and ones that haven't set a date for reopening yet. Will schools open again in September? And what needs to happen for them to do so? CNBC spoke to a number of experts on the topic as part of their new The Next Normal series, analyzing various aspects of life and what they may look like going forward. Dr. Dhruv Kular, a physician at New York Presbyterian Hospital, points out that most parents will not feel comfortable sending their kids back to school until infection rates are drastically lower than they are now, which, he postulates, will not happen if we reopen the economy too early. Being hesitant to reopen the economy, though, is complicated by the fact that many parents aren't able to return to work until their children can return to school. As former Labor Secretary Robert Reich points out, most Americans, quote, can't afford childcare of any quality during the school year. 78% of workers live paycheck to paycheck. There's no way people can do this for long on their own. They aren't set up for it, frankly, end quote. So how do we ensure schools are able to reopen and do so responsibly? Dr. Ashish Jha, a professor of health policy at the Harvard T.H. Chan School of Public Health, says that reopening in September must be matched with aggressive testing and social distancing. For example, the suspension of assemblies and maybe even fall sports. Because while kids may not be as susceptible to serious outcomes from COVID-19, they can still spread it as much as anyone else. Jha recommends simple throat swabs, which, in addition to being effective tests, will further work to ease safety concerns from parents on sending students back to school. In China, schools have been slowly reopening for older students first. They're utilizing small class sizes, social distancing, temperature checks, the wearing of masks in classes, and the use of smartphone apps we've discussed before that show a green icon if an individual is free of infection risk. These protocols are similar to what the teachers' union in New York City is demanding. A petition from the United Federation of Teachers is calling for widespread testing, temperature checks upon entering schools, rigorous cleaning, protective gear, and campus-level contact tracing before schools can reopen. But even if all of those precautions are put in place, schools still need to make plans for remote learning. Because if one student tests positive, then every other student, teacher, and administrator they've come into contact with will have to go into quarantine. And so will their parents or guardians. Peter Bach, director of the Center for Health Policy and Outcomes, calls it, quote, irresponsible to open schools without a parallel plan for remote learning at home. And it's not just about quarantining positive cases. What happens if there's a second shutdown? Whether it's because of subsequent outbreaks in certain locations, a second wave, or peaks caused by premature reopenings, we need to at least prepare for the reality of more school shutdowns in the future. Quoting Dr. Jha again, if we are super aggressive on testing, if we put into place moderate social distancing when possible, if we have a therapy that works for people who can get very sick, if we do all of that, I think we can keep schools open all year. It's going to be very hard to pull off, but we are more than capable to pull it off. End quote. Ending today on a bit of a lighter note. Imagine being a traffic reporter in a nation where traffic doesn't really exist anymore. In San Francisco, for example, traffic has fallen by 90%. Traffic anchor Sal Castaneda of Oakland, California station KTVU still logs on from his home studio every day to deliver the traffic report on the news. They have us on because I think we give our viewers a sense of normalcy, he says. KTTV Fox 11 reporter Rick Dickert in Los Angeles has started a new segment for his traffic report, Speeder of the Day, in which he literally sends the Skyfox traffic chopper out to tail the fastest lone car on the freeways. But even though many of the roads are clear enough for drivers to give Dom Toretto a run for his money, the traffic cops are still out there. Quoting the Wall Street Journal, officials of the California Highway Patrol say they issued 2,493 citations statewide for driving more than 100 miles an hour between March 19th, when the state's stay-at-home order began, and April 19th, or 1,158 more than the number issued over the same time period last year. End quote. But where the roads are a bit more clear of drag racing and drifting, they've been filled with everything from skateboarders and unicyclists to geese and deer. Some parents are also taking advantage of the reduced traffic to teach their kids to drive in safer than usual conditions. And some cities have experimented with full road closures to give people more space for recreational activities at an appropriate distance from one another. In Oakland, for example, they closed 74 miles of streets to through traffic on April 11th, or 10% of the city's total. And here in New York City, 7 miles of streets near parks were closed over the weekend as part of a new Open Streets social distancing initiative. None of those closures happened near me, so I didn't check them out, but I will say it's been weird how reduced the traffic is in my neighborhood. There's a major boulevard nearby that's usually unbearable to walk along because traffic is so dense and loud, but I took a stroll along there around sunset the other day, and it was almost pleasant. And that is all for today. As always, this show is produced by Ride Home Media. We'll be back with you tomorrow. Be well.